Hi, everyone. I see my team at Healthy Women. Thanks for joining me this afternoon and welcome, Patricia Geraghty. It's so great to see you.
Oh, it's great. I've been looking forward to this. Thank you for inviting me to this chat.
Oh, I'm delighted to have you. So let's talk about your background a little bit before I kick things off and we talk about self-care. First of all, you are a practicing nurse practitioner. Right now, you taught at and started a family nurse practitioner program. And not only did you practice in family practice area, but you also are teaching women's health, correct?
Correct.
And you are currently writing a book.
I am.
And you're a mom, and you volunteer at a clinic, correct?
Correct, yes.
Yay. So you're busy.
I'm passionate about women's health. It's a deep passion for me, and I feel privileged by the women that allow me to participate in caring.
Well, it's so great. And I want to wish you, before we even kick off our conversation, happy Mother's Day. And I also want to say Happy Nurses Week, which is one of the weeks that I actually love celebrating.
Happy Nurses Week, right back at you, Beth.
Thank you. So we met, Patty, by a mutual friend and colleague, Donna Hillhouse, who heads up the amazing group at Selfcare. And she was kind enough to connect us. And she's also a nurse, so I love our circle. And today's conversation is really about self-care. And you and I had a quick conversation about this yesterday, saying we weren't really big fans of the name of self-care. But one of the questions I wanted to throw out or to kickstart our conversation is, do you think women today in 2021 are giving themselves permission to take care of themselves?
Oh, no. It's not even a matter of me think. Sometimes scientific research simply confirms what we already knew. And with the pandemic, women have made major sacrifices, generally in the interest of caring for the people in their team, their family, their coworkers. So, and self-care takes time. When we think of all of the very best, deepest recommendations for self-care, none of them are quick and easy. So I would love to see, as we build back better, a team effort to get women taken care of. And one of the reasons I'm passionate about women's care is because if you take care of the woman, you take care of the entire community.
So true, right? And that's the piece where I think we're missing. And Healthy Women, we do so much research on that topic. And I feel like every survey that we do, we always include a question about, do you take time for you? Are you putting yourself first? And unfortunately, what we're seeing is that we continue to put everyone else before us, including our family pet. So the dog comes before our health. And so I am here as the president and CEO of Healthy Women, as a mom, as a practicing nurse, to say we need to stop this. And if I do anything in the next 25 years, if I meet the goal that I've set for myself and for this organization, is that we are going to put ourselves on the list. And I know we're never going to be number one, but I will be happy if we're number 3 on that list, where we feel that we can prioritize and take time to take care of us.
I agree completely, Beth. I think when we say put yourself first, it doesn't really resonate for a lot of women. They see that almost as a sign of privilege, that right. You can put yourself first. And what I really like is a team approach. So even not 1, 2, or 3, but rather put yourself on the team, because a true team, everyone is working together. And in fact, when my children were very little, they were in elementary school, was when I was still seeing patients as a nurse and going to graduate school full-time to become a nurse practitioner. So the whole approach was, we're a team. And not many people in that time, it's a long time ago, were telling their 7-year-old and their 9-year-old, you need to do the dishes, you need to do this. But within a week of doing that, my 7-year-old said to me, Mom, I'm probably the most competent kid in my class.
Love that.
And so he always used big words, but that's actually one of the approaches that I use when I'm working with women in terms of helping with self-care.
Right.
Is you're doing your family a favor. I recommend family meetings. Have a meeting. Mom needs to exercise. That takes some time, and it often takes some time away from small children.
Right.
So how are we going to do this? Not how am I going to do this, but how are we going to do this? And, the plumbing breaks, the bathroom's flooded, grandma's in the hospital with a hip replacement.
Right.
Dad goes to the gym. Mom, oh my gosh, we're out of bread. I need to go to the store.
Right.
So I'll say, put your peanut butter on a tortilla and go to the gym.
I love it. No, and I think that's so important. And I know for me, I started, I run, and I always said, and I run with a group of moms, and we said, this is the best therapy, is just to get out and run. And we may have problems. We each may have some situations that we share during our run, but by the time we're done, we've all solved it. And we just are like, how awesome is this? Like, we're not only getting exercise, but we're solving each other's problems. And I remember my son always saying, running makes my mom a better mom, and so it's like they realize the importance of, and I think more respect too for the moms that are taking that time and putting themselves in, whether it's exercise, whether you're just, using 15 or 20 minutes to sit down and have a cup of coffee on a park bench, just carving out that special time for you is just so important. Let's not, I want to turn it to COVID, right? Because this time, this past year has been so stressful. And I'm thinking about all the, the women that have, managed so many hurdles with homeschool, for many, trying to manage a full-time job while homeschooling, and those that had to drop out of the workforce because they had young children and realized that they couldn't do it all and do it all well. And then I'm also thinking about our colleagues, our nursing colleagues who did not have the choice to take time off. It was absolutely crazy. And when you're working, 12-hour shifts and now you don't have childcare, the enormous amount of stress that was put on so many nurses and healthcare professionals, during this last year. What are some of the recommendations you would have for your fellow colleagues in the hospital, as well as overall moms? Like, what are 3 things that you would recommend doing to help take better care of ourselves?
Well, again, I'm going to go back to the concept of a team. Your running group, Beth, is your team. Your team
Right.
is very fluid. So when it comes to doing the dishes or doing the grocery shopping
Right.
or even preparing meals, that might be the team in the household.
Mm-hmm.
But for exercise, we know even a virtual team. And for our colleagues, the nurses who have been working immense hours, many had to move away from their families to protect their families until they were able to be vaccinated. It's very clear that that team are the people at work.
Right.
And it's very clear also that when they are supporting each other, everybody wins. The nurses win, the patients win, the whole team wins. So assessing whenever you need to do something around self-care, the first question you ask, we nurses, we always start with assessment, don't we? And that's a great way to
run your life. It's always the first thing. That's right.
Yeah. Run our lives that way. So assess, who is my team here? Who is my support here? And if I don't have a team, then how do I build one, even if it's virtual? And obviously virtual works for a lot of things, from support at work to getting out to exercise. And then the second thing is to realize that good is good. Our culture, the United States, is very hung up on best and worst. And yet the healthiest cultures in the world, their primary value is of balance. And so we make things very complicated by wanting to know what's the best thing I can do. What's the very best diet, the very best form of exercise. No, go for good. Good is good. And so set realistic expectations of yourself. When it comes to movement, what's real interesting is the Blue Zones Project, which was started by Dan Buettner at National Geographic. identifying the 5 longest lived communities in the world, and then going in and really investigating what is going on here. Why are these people living and still herding their goats in the mountains of Greece when they're in their 80s and 90s?
Mm-hmm.
And one of the things that came out about activity in that is it isn't cutting out an hour a day for intense activity.
Right.
It was actually having an inefficient kitchen and moving around all the time to keep your work going. So when I'm in the clinic where I speak only Spanish and I ask women about exercise and they all shake their heads no because they are probably working 2 jobs.
Right.
Well, I say, what is your job? Oh, you're a clerk at a grocery store? Are you on the move all the time?
Mm-hmm.
So give yourself credit. Find your team, be realistic about your expectations, and then give yourself credit, because a little bit is good. It doesn't always have to be best.
I love that. And, those little wins are so important, right? And I do feel like we're our own worst enemies, that we never give ourselves credit for some of the things that we do. And I love the team approach. I'm a big believer in, team efforts. And so I love that analogy. What would you say, what's the most beneficial physical or emotional self-care?
Well, they go together, don't they?
Yeah. Yeah.
So, I mean, I call walking active meditation.
I love it.
Because it is both mental and physical.
Right.
And so it's finding your passion. And fortunately, we all have different passions. So the walking trails aren't jam-packed, because
Right.
there are also some people out there that would rather be rowing a boat or climbing in a gym or whatever.
Mm-hmm.
So find your passion and then do that, but recognize that it's mental as well as physical.
And when you're seeing, when you were seeing some patients, and as you, continue to support other, women that are looking for that, that kind of the routine or the self-care, if you said, how do you begin that conversation with them? Like, I'm just thinking, like, as you see, when you do your assessment, like, do you ask them straight out, like, what are you doing for you? Or have you, gone for your annual women's wellness visit? Do I'm just wondering, how do you even begin that conversation? Or can you recognize some of your patients that need that that conversation and that boost on, what you are important, and we need to create that team for you?
Yes, that's a great question, Beth. And in fact, I usually start with the real big specifics, because again, that self-care doesn't necessarily resonate for women, but I might ask her about how is her weight? What is her physical activity? How is she sleeping? And those specifics, those are questions that women are sort of expecting
Mm-hmm.
at an exam. Then that opens up how she feels about taking care of herself.
Right.
And usually we approach it to, well, this is what you want to do. What are the barriers to that? What is keeping you from doing that? Because if you let me have 4 important things, that would be 4th, is problem solving. And saying, okay, what's keeping me from doing the things I need to do? There's a reason for processed foods. They aren't just processed for that reason. They're processed because they're fast. And so what is the reason that I can't have my family eating whole unprocessed foods?
Mm-hmm.
And what are the barriers? And then what do I do about it? And so that's really how it comes up with individual care. And it will go, and it's our job to know
Right.
how things are tied together. So a lot of women are, and I'm going to raise my hand here, are concerned about how our weight has changed over
Right.
this past year.
Mm-hmm.
And when I ask her, she talks to me about weight, and I ask her about sleep, she sort of looks at me confused, because aren't I supposed to be asking about exercise? But in fact, that's another thing women do to take care of themselves, is they give up sleep.
Right.
And it's also very clear that 7 or less hours of sleep, less than 7 hours of sleep at night, has about a 700% increased risk of obesity. So it's those are the things that I talk more about, specifics with self-care. And then we set up goals. And we set up goals with good is good.
Good is good. And then how often are you seeing your patients? Are they coming back annually, or do you try to follow up more frequently?
great, great questions. So we've often called the annual gynecological exam,
Right.
practicing in women's health, as I have to go in for my pap test.
Exactly.
And we don't need a pap test every year anymore.
No.
So a couple of non-specialist organizations,
Mhm.
medical organizations, have come out with guidelines saying you do not need to see a gynecologist every year. Well,
Right.
that's fine as long as primary care is going to take over all of those other women's health things.
Right.
Because what is a pap test about? One body part, the cervix. And what
Right.
does it find? One disease, pre-cancer, hopefully pre-cancer,
Right.
not cancer. So
Mhm.
we're all going to really agree that there's more to women than that, all right, than a
Yes.
cervix.
100%.
So yeah, I do see, and I am a firm believer, and I've gone on record saying that I am a firm believer that women need at least an annual exam about them. Can we carve out 1 hour a year about ourselves? I think so.
I know so. I 100% agree with you. And it's all about head to toe, right? So when I agree. And that's one thing that scares me about the changing guidelines in the pap test, because I feel like so many women would always keep that appointment, that annual appointment, and that pap test, language is what triggered them and said, I'm going for my annual pap test, so I do think one appointment, absolutely, that should, it should be a no-brainer, and we should be able to manage that. But I also think now with telemedicine playing a bigger role, is there an opportunity? And now I know I'm talking about changing, healthcare, but is there an opportunity to do those check-ins for those women that may need a bit more hand-holding to get them to the point where, we feel as practitioners that they're on the right track. And I'm just thinking now telemedicine can plays a bigger role now, right? And through COVID, we're seeing more practitioners use that as
We've always known that it was a good idea, and we're finally being allowed to do it by the reimbursement agencies.
right.
That has always been the biggest barrier, is that any
The
phone work we
reimbursement.
did
That's
was,
right.
yeah, free work, and I have to pay my rent. However, in women's health, some translates very easily to telemedicine, sleep, weight, all of the stress, anxiety, those things. Some doesn't. So I did find in the pandemic that very early on, I needed to go back into the office and see my patients with all kinds of safety measures. I would like to see my women once a year and then do the follow-up and the check-ins and be part of her team, right?
Right. The team.
Yeah, and that is very easy. My patients have my phone. They text me. It's an incredibly efficient way to do those check-ins and see how things are going.
That's amazing. And you're using that, you're using that more and more. Just
Yes.
quick check-in and quick answer. And that's great to hear. That's amazing. I'm just looking over a list of some of the questions that people have wrote in, and one question is, how do I manage self-care without appearing selfish?
Oh, fantastic question.
Yeah.
Thank you for asking that. And again, let's not call it self-care. I know that's our title
I know
today.
we're not.
But-
I will not call
Yeah,
it self-care.
yeah, but let's call it everyone care.
Everyone cares.
And when you are caring for yourself, you are actually caring for other people. And I'm not doing the put your own oxygen on first thing. I'm actually doing you're modeling. And if we're mothers of young children, we certainly do not want our children to grow up to not take care of themselves.
Mm-hmm.
And we desperately wish many, many times that our children would do what we tell them to do. But it's also very clear that the strongest influence is they do what we do. And ancient literature, there was a study done that the woman's physical activity enhances the child's physical activity, and the man's physical activity has no influence whatsoever. Now, this is an old study, and maybe it's changed since then, but it does really show that when you're telling your family, I can't pick you up that day because I'm going for a hike, or I can't do this for you that day because I have this to do, you are telling them that your care is an important part of the whole family's schedule. And so it isn't selfish, and it maybe feels a little bit like I'm exploiting that good old very, very powerful tool of maternal guilt. But if you're telling her that by modeling caring for herself, she's actually teaching her children. And that is a very powerful thing.
I love it. Love it. Let me look at some of my other questions here. I haven't been able to get any screenings because of the pandemic. When should I start scheduling?
Start now. Now. I mean, obviously, the entire pandemic, we need to look at geographic regions independently. But most of the country is very, very safe to go in. And if anyone knows how to do what in the days of our training, Beth, we called universal precautions.
Yes.
The safety measures in place, how to do it. It's going to be a healthcare office.
Yeah.
So go in and get those started now. Pat yourself on the back that you're getting there rather than beating yourself up because you weren't able to get in. Exactly. But we are anxious. I mean, they're starting to publish accounts of how many cases of cancer we think we will see in the coming year because of delayed screening. I don't like scare tactics. None of us do, even as powerful as they might be. But what I tell my patients will sometimes come in and say, I haven't been here in XYZ amount of time. And I'm like, you're here. You're here. Give yourself credit because you're here now.
Right. No, I love that too. And what I've been saying is we're seeing patients on time and our waiting rooms couldn't be any cleaner, right? So it's been, it's been in and out. It's been actually lovely as far as keeping your appointments on time and streamlined. So we've been talking a little bit about technology and how you're using technology in your practice and how well it's working. Do you recommend any apps for your patients? And if so, is there any apps that you love using or that you love to recommend to help improve?
Yes. And first off, obviously for women that are still menstruating, a menstrual cycle tracker. Absolutely. Okay. I tell my young patients, will you please go home and teach your mom how to find one of these? That's great. And I did ask one of my young patients, which one do you think is the best? And she's, I don't know the name, but it's the one with the flower. Well, if you go, it looks like Georgia O'Keeffe vomited. Okay, they all have flowers, but they're generally very good. And so that's an old app for women's health, but it's a really critical one. The next one that has wide applicability that I really like is a step or a fitness tracker, because much of women's activity, again, is not, I'm taking 45 minutes for a hike, but it's I'm running around all day. I have to go up and down the stairs, the laundry, I'm doing, this and this. So I really think fitness trackers embrace women's activity that they do all day long. And then a third, a real special group, relatively new app. I do a lot of chronic pelvic pain also. Okay. And there's a new app out called Endowheel, as in endometriosis wheel. Yes. And it's a really stunning application because it takes into account, it's a symptom tracker. Right. But it can, and I'm using it with all of my pelvic pain patients, not just endometriosis. Good. Because it takes into account, very specialized, what your symptoms are, but also what is the impact on your life? Because that is, critical. And it's hard to talk about too. So that just gives the patient the power, right? And so some of the areas where they may not realize it's important to share with you or track, that application is helping them put in that information so you can help hopefully improve their condition. It's when you're going in for a healthcare visit of any kind, it's really great to be organized before you go in. I'm privileged in my setting in that I have minutes on the clock with patients, but many settings the clinician does not. That's not true. Correct. And so if you even there's symptom trackers out there as apps too. ShareCare, I'm on their medical advisory board, has one called AskMD. I know we don't like the name. They know we don't like the name. Because that we need to change. We'll have to talk to Donna about that. We need to change that name. But AskMD is a very, very efficient symptom tracker that you can fill out, print up, copy, and then you're going in with a lot of your time with that health clinician already organized, because those answers to questions are organized in a way that the clinician thinks, not necessarily the way the patient thinks, but it speeds up the process. It facilitates the process of getting to a solution.
That's brilliant. And it probably helps with that conversation. So many patients may be scared to even ask or understand, figure out how to bring up, right? And so having those questions, having information to share helps bring up the conversation. It's almost like an icebreaker.
Yes.
And gets to the bottom of the question. And that's great to know. So in our final few minutes, I would love to talk a little bit about your book. I know you've been busy this past year, right? Taking a little time off, shutting down from social media, you shared, to focus on writing a book. Can you tell us a little bit about the book that you're writing?
Oh, thanks so much for asking. It's actually a book on menopause.
Okay.
It's going to be called Each Woman's Menopause, because the two premises of the book are, one, that women all over the world go through this natural transition. Mm-hmm. So much of medical research is really focused on North American women, women of European descent, and everyone else is treated as an other. Oh yeah, and then in this and then in that. And so from the very beginning, this book has been written by everyone is included. But the each woman is also that every woman's menopause is individualized. Now, this work that is almost done is actually directed at the healthcare professional. It's directed at advanced practice nurses, nutritionists, psychologists, and that's because there's a giant gap in clinical knowledge about how to take care of Medicare. A friend who's a physician said to menopause. A friend who's a physician said to me, "Well, you write prescriptions for hormones?" And oh yeah, that's the gold standard care for women who need them.
Right.
Oh yeah, well, I was never taught that in medical school, and I read one article and it's just too complicated, so I don't do it. So that sort of is an anecdote that illustrates this massive gap. And so there's a huge need. I love talking to patients, but there's a massive need for clinicians to get this information.
And you belong to one of our favorite organizations, the North American Menopause Society. You're actually on their medical advisory board.
Not with them. Yeah, no, I'm on a different website about women in menopause on their medical advisory board, but NAMS is huge. Yeah,
it's huge, and we work closely with NAMS, and we are definitely going to have you back on once your book is published, because menopause is one of our hot button topics. As you may know, we focus on women's health 35 to 64. So it's perimenopause, menopause, and postmenopause. And you're absolutely right with the disconnect with healthcare providers and patients that are, going through menopause. We have a survey. We actually did one of the biggest surveys since the Women's Health Imperative Survey that spoke to the need not only for patients, for women to become more aware about menopause and the questions to ask and the symptoms, but for healthcare providers to become more educated and to be able to manage patients that are going through, because they're not having the conversations with their patients. And so there is such a need, and it's so exciting to know that you're going to be coming out with a new book that's going to help meet that gap. So we look forward to, we are definitely going to have you back on, and it's a privilege to talk to you today. And thank you so much for your time and for providing some tips on how we can form our team and take better care, take better care of everyone care, right? That's our new term, is everyone care.
Yes. Oh, I love that. I love it. Team care. Yeah. And thank you so much. This was fun. I could keep chatting forever. I'd look forward to doing it again.
Me too. Have a great day. Happy Mother's Day. Happy Nurses Week. Thank you again for joining us.
You too. Thanks. Bye-bye.
Bye-bye.